Welcome back, my dear friends. Now let's talk about the next major nerve, that is your median nerve. Okay, so median nerve, it is also known as the laborer's nerve, guys. First, write down there median nerve. Median nerve is also known as the laborer's nerve. And one more name that you have to remember here, it is also known as the eye of hand. So basically, the median nerve, it is also known as the laborer's nerve, or else it is also known as the eye of the hand. Now, as we have been doing the same thing, we have to continue, guys. In any nerve, the first thing to write down is the origin of the nerve. And we have studied in brachial plexus very clearly. I told you the median nerve will be originating from two sources, like it's beginning from the lateral cord also as well as the medial cord. If you remember that LML, L was lateral root of the median nerve, and in M4U I told you one of that is medial root of the median nerve. So both the roots will join together to form your median nerve. So that means median nerve is originating from lateral cord as well as the medial cord. Lateral cord and medial cord of brachial plexus. Now, if the origin is done, the next thing is the root value. Now, because of the lateral cord, the root value will be C5, C6 and C7. Okay. And because of the medial cord here, the root value will be C8 and T1. Hope you're getting it, guys. So, because of the lateral cord, the root value will be C5, C6 and C7. And because of the medial cord here, the root value of the median nerve will be C8 and T1. It means that, in short, the complete root value of the median nerve is C5, C6, C7, C8 and T1. That means all the roots are contributing for the formation of your median nerve also. Okay. Now, once this is clear, after origin, the next thing to write down here is supply. Now, let's see the median nerve will be supplying to which muscles first of all. And let us do the same thing again, guys. Let us go in sequence. First, we'll see in the arm and then forearm and then we'll see in the hand, guys. So, first arm. Okay. So, first we'll see the median nerve will be supplying to which muscles in arm, then forearm in the hand. Now, in the arm, again the same thing. Try to recall our golden rule. It is not supplying to any muscles in the arm. Why? Because in the arm, all the muscles in anterior compartment, musculocutaneous nerve, all the muscles in the posterior compartment by radial nerve. So, therefore, median nerve is not supplying to any muscles in the arm. So, in the arm, it is not supplying to any muscles, guys. Then the next one will be the forearm. Yes, median nerve will be supplying to the muscles in forearm. Now, which compartment? Will the median nerve will be supplying to the anterior compartment or the posterior compartment of the forearm? Yes, remember it will be supplying to the muscles in anterior compartment of the forearm. All your flexors, but except which one? Except the medial 1.5 muscle, flexor carpi ulnaris and medial half of FDP. Why? Because that will be taken care by ulnar nerve. That will be supplied by ulnar nerve, and we have already discussed that in the ulnar nerve topic in detail, guys. Okay, so we can write down here as median nerve will be supplying to all muscles of anterior compartment of forearm. All the muscles present in the anterior compartment of the forearm, except which one? Except the medial 1.5 muscle. So, in the forearm, the median nerve will be supplying to all the muscles of the anterior compartment of forearm, except the medial 1.5 muscle. And we all know very well what is the name of this one, and which will be supplied by the ulnar nerve. Everything we all know very well, guys. Now, after that, welcome to the hand. Now, arm is done, the forearm is done, and now the next thing is the hand. In hand, in total, you'll be having 20 muscles, and out of that 20 muscles, 15 muscles will be supplied by ulnar nerve, and the median nerve will be supplying to only the thenar group of muscle, that to accept adductor pollicis. So, all your thenars except the adductor pollicis, and then it will be supplying to first and second lumbrical. That's all, the remaining 5 muscles. Okay. So, in the hand, the median nerve will be supplying to which muscles, guys? The thenar muscles. Thenar muscles except adductor pollicis. Except adductor pollicis. And number 2, it will be supplying to the lumbrical number 1 and lumbrical number 2, the first and second lumbricals here. Wow, it makes the things easier right now to learn the supply of this median nerve in the easy manner, guys. Okay. So that's the reason why I'm telling you, like, again and again, guys, don't try to directly jump and learn about the ulnar nerve and the median nerve and all. That will be the biggest mistake. You cannot just simply mug up all these muscles and everything. So there is a proper logic, there is a proper way how to do that. So follow all the videos in sequence. First you learn about the muscles and everything, then this becomes easier for us, guys. Now after learning the entire origin, the supply and everything is done here. Now again let us do the same thing as we have been doing with other major nerves, guys. Let's draw a schematic diagram of median nerve. Now before drawing the entire diagram of the median nerve here, guys, let me first of all give you the entire planning regarding that one. Okay, let's see on our upper limb here, and then later on we'll be actually drawing the diagram over here. So first of all, what is happening here? The median nerve is passing through your arm. It is not supplying to any muscles in arm. Then it will enter into the forearm. How will it enter into the forearm? It is going to enter by passing between the two heads of pronator teres muscle. That's important here. Okay, so pronator teres muscle will be present here. There will be two heads of that. Between the two heads, it will pass and enter into the forearm. The first point to learn. Second point here, after entering into the forearm here, the median nerve will give off a branch, and that branch will be the anterior interosseous nerve. Anterior interosseous nerve, guys. So posterior interosseous nerve was a branch of radial nerve. Radial nerve will give rise to posterior interosseous nerve, whereas anterior interosseous nerve, AIN, will be a branch of your median nerve. Okay, and after that branch is given, they are taking care of all the muscles in the anterior compartment of the forearm. I'll let you know the diagram. Then the median nerve will further continue and enter into the hand. And here, one more point that you have to take a note of. When it enters into the hand here, what do you have here? You'll be having the flexor retinaculum. And you need to decide whether the median nerve is going to pass superficial to the flexor retinaculum or is going deep to the flexor retinaculum, guys. And remember, median nerve is going deep to flexor retinaculum. And what is the meaning of deep to flexor retinaculum? Nothing but it is actually going through the carpal tunnel only. So median nerve is actually going through the carpal tunnel, guys, and then enters into the hand. In hand, you all know very well, it will be taking care of the thenar and the lumbrical, guys. Is it okay? So that is the entire picture. Now let's make a note of this one crystal clearly, guys. So again the same thing here. Imagine this one to be the lower end of humerus. And in the lower end of the humerus, you'll be having the lateral epicondyle and the medial epicondyle. Okay. Median nerve will actually enter into the forearm. It is also a content of your cubital fossa also, guys. So it's entering into the forearm. But the important thing to remember here, it enters into the forearm by passing between the two heads of pronator teres. Between two heads of pronator teres. That's an important thing. It means that what is the first muscle to be supplied by median nerve? You can see in the entire course, till now it has not supplied to any muscle. The first muscle to be supplied by median nerve will be pronator teres only, guys. Now, after entering into the forearm, the median nerve will actually give rise to a branch, and that branch here will be the anterior interosseous nerve. So this is AIN. This will be the anterior interosseous nerve. Okay. So median nerve, the main median nerve is going to continue further, but it is giving a branch that is anterior interosseous nerve. And out of these two, what you have to learn here is that, come on guys, recall from the topic of muscles of forearm we have already discussed. Try to recall in the anterior compartment. In the anterior compartment of the forearm, all the muscles are actually arranged in the superficial layer and the deeper layer. Superficial and the deeper. We have learned all the names of the muscles: pronator teres, flexor carpi ulnaris, flexor carpi radialis, palmaris longus. Then the deeper we have learned about FDP and the pronator quadratus muscle and all. Now, out of that superficial layer and the deeper layer of the flexor muscles, remember that main median nerve, the median nerve which is going further, that main median nerve, that is the one which will be supplying to all your superficial muscles, guys. The superficial muscles. So in that superficial muscle layers, you will be having your flexor carpi ulnaris. Okay, and then you have got the flexor carpi radialis. Fine, and in the middle of these two, there will be palmaris longus, and even it will be supplying to FDS, flexor digitorum superficialis. Okay, so that is the reason why I have made you learn all these muscles in the image based question itself. If you write it like a list here, you will not understand. If you directly write it like a list and mug up, you will never understand. So already with the images we have completed, I hope you are able to recall. So flexor carpi ulnaris, flexor carpi radialis, The palmar is longest in the middle, and then the FDS also, guys. Flexor digitorum superficialis, also supplied by the median nerve only. Then what about the anterior interosseous nerve? Anterior interosseous nerve, that is the one which is taking care of the deeper layer, and in the deeper layer it will be supplying to FDP, flexor digitorum profundus. And we all know very well, FDP muscle, the medial half of that is supplied by ulnar nerve, and the lateral half is the only one which will be supplied by the median nerve. So median nerve is supplying only to the lateral half of FDP, and that to which branch of the median nerve? So that is anterior interosseous nerve. What else do you have in the deeper layer? You also have got flexor pollicis longus, a muscle for flexion of thumb, flexor pollicis longus. And finally, you also have the pronator quadratus muscle, guys. Pronator quadratus muscle. Fine. So in short, what I am trying to teach you here is that keep in mind that the main median nerve, the main trunk of the median nerve which is moving forward, that is the one which is taking care of superficial layer of the muscles, whereas the anterior interosseous nerve will be taking care of deeper layer of the muscle. It makes sense. Okay. So the anterior compartment of the forearm, superficial layer is supplied by main median nerve, deeper layer is supplied by anterior interosseous nerve, the branch of that one. Now after the arm and the forearm, let's move ahead. Now the median nerve will enter into the hand. And again the same thing, you have to learn or take care about one more detail here, that is flexor retinaculum. And median nerve is actually going to go deep to flexor retinaculum and then enter into the hand. So median nerve is passing deep to flexor retinaculum, or the same thing we can say it is passing through carpal tunnel. So below the flexor retinaculum, you'll be having carpal tunnel, and the median nerve is going through the carpal tunnel, guys. Now, after entering into the hand, it's very much easier there. It will be supplying to your thenar muscles as well as the lumbricals there, guys. So let us just finish off here. It will be giving the branches here. Yes, it will be giving those branches here. Like you have got like a recurrent branch and all those things. I think those many details are not required for you guys. So one of the branch will be taking care of thenar muscles. So it will be supplying to all the thenar muscles except what? Except the adductor pollicis muscle. That's an important exception. Adductor pollicis will be taken care by ulnar nerve. And then it will also be supplying to the lumbrical number 1 and the lumbrical number 2. The two lateral lumbricals, lumbrical number 1 and 2. Fine. This is all easy, guys. There is no confusion about that one. And now welcome to one of the most important concept here. Apart from all this, it will give a branch here, and this branch is actually the digital branch. See, we are actually done with the motor supply to the muscles completed. Now welcome to the sensory supply. So one is digital branch, guys. And one more thing very important to note down here is that you imagine my hand here to be the flexor retinaculum. Now if this is the flexor retinaculum, where is the median nerve going from? The median nerve is actually going from below, deep to that one. Okay, you just imagine my pen here to be the median nerve. Fine. But before going deep to the flexor retinaculum, the median nerve will give a branch, and that branch will be actually going superficial to the flexor retinaculum. Hope you're understanding me. So before going deep to the flexor retinaculum, it's giving a branch, and that branch will be going superficial to the flexor retinaculum, and that is palmar cutaneous branch. Okay, so it's very simple, guys. Median nerve is going deep to the flexor retinaculum, but the branch, that is your palmar cutaneous branch, will be going superficial to this one. Palmar cutaneous branch, guys. Now let us learn a little bit in more detail about these two branches, the palmar cutaneous branch and the digital branch, and their supply. See, basically they are actually, both of them are cutaneous branches only. They are going to supply to the skin, and that to the skin on the palmar surface. And try to recall, on the palmar surface, the skin on the medial 1.5 digit, the little finger and half of the ring finger, ulnar nerve, lateral 3.5 digit, the thumb, index, middle finger and half of the ring finger here, lateral 3.5, 1, 2, 3.5, will be supplied by median nerve. So we'll be actually broadly learning that lateral 3.5 is supplied by median nerve. And now today we'll go a little bit in more depth of this one. Lateral 3.5 by median nerve, but today I'll tell you a little bit in more depth about the digital branch and the palmar cutaneous branch. So let's draw a small diagram here, guys. Little finger, the ring finger, middle finger and the index finger, and the thumb here. and this one here will be the palmar surface, guys. Now in this palmar surface, remember, lateral 3.5 is taken care by median nerve, fine, well and good. But in that 3.5 also, in that lateral 3.5 also, remember that the digital branch is the one which will be supplying to the lateral 3.5 digits. I'm using the same color there. It will be supplying to the lateral 3.5 digits. Okay. So digital branch is the one, it will be supplying to only the lateral 3.5 digits, fingers. Whereas the palmar cutaneous branch, it is the one which will be taking care of the lateral 3.5 palm. Hope you're getting the clarity here. Is it okay? So broadly we'll be learning that the lateral 3.5 digit will be taken care by median nerve, but in that also remember the digital branch will be supplying to the lateral 3.5 digits, whereas the palmar cutaneous will be supplying to the lateral 3.5 palm. Hope it is clear. Now that is about the motor supply and sensory supply and a beautiful schematic diagram of the median nerve, the entire median nerve and its course and its supply. And I hope all of you are able to understand here. This is the arm. It is not supplying to any muscle, and this will be the forearm here. It will be supplying to all the muscles in anterior compartment except medial 1.5, and this finally is the hand. And in the hand, median nerve will be supplying to only 5 muscles, the remaining 5 muscles, that is your thenar and the 2 lumbricals. Hope it is very clear, guys. Now once it is clear, again the same thing, guys. After completing the normal entire nerve and a schematic diagram of that, now again we have to go and learn about the injuries now. And again the same thing, the median nerve injuries are also divided to higher lesion and the lower lesion. So where can be the injury, guys? Number one, the median nerve can be injured, higher lesion, the median nerve can be injured here. Let me just write down here as number one, guys, higher lesion near the elbow. And number two, the median nerve can be injured in the carpal tunnel. And I think I don't even have to tell you the examples here. Number one, higher lesion, the median nerve is injured here. It can be either due to the pronator teres syndrome. Now what is this? Between the two heads of the pronator teres, the median nerve can be compressed or trapped. Pronator teres syndrome. Number two, one more thing, Struther's syndrome, and we have discussed about that in detail, the Struther's ligament and all those things, Struther's syndrome. And number three, due to fracture, the supracondylar fracture of humerus and all, median nerve can be involved, guys. These are the reasons for that one. These are the causes. What about the lower lesion of the median nerve injury? In the lower lesion, it's very simple and it's very famous one. The median nerve can be involved in the carpal tunnel syndrome. Carpal tunnel syndrome, median nerve, lower lesion. Now, how to differentiate, guys? How to differentiate? That's something really important here. Listen here very, very carefully. Again, we'll do the same thing. First of all, we'll try to learn it practically. We'll apply on our hand and upper limb and all. And then afterwards, we'll make the notes here. So with full concentration here, observe and look at me here, guys. Guys, do one thing here, guys. You just, keep your hand completely relaxed. If you just keep your hand completely relaxed, don't do any flexion or extension, nothing, sir. Completely relaxed. If you just keep your hand completely relaxed here, you will observe one important feature. All your fingers will be lying in like one plane, whereas the thumb will not be along with the fingers. It is like more abducted. And that is the feature of human beings like you and me. If you just keep your hand completely relaxed here, not doing anything, no flexion, no extension, you will observe that all the fingers are in one plane, but the thumb will be in a separate plane. It will be like more abducted. That is a feature of human beings like you and me. Now, my dear friend, just imagine there is an injury to the median nerve. If the median nerve is gone, then all your thenars will be gone, except adductor pollicis. Adductor pollicis is still working. Why? Because that is supplied by ulnar nerve. Important. And not only that, even the lumbrical L1 and L2, that is also gone. So if the median nerve is injured here, guys, all your thenars are gone, all your lumbricals are gone on this side, except which one? Adductor pollicis is the only muscle working. And we all know every time the rule, whenever all these muscles are gone, the only one muscle which is working will be like more dominant. That is why, will your thumb will be again in the same position like this? No, only adductor pollicis is working there. So the thumb will be in more adducted position. So when it is in adducted position here, okay, I hope you remember abduction, adduction of thumb, it will be more adducted. And when it is in adducted position here, it is along the plane of all your fingers. So it is coming along the plane of all your fingers there, and that is not at all the feature of human beings like you and me. It is actually the feature of apes. That's the reason why it is known as ape thumb deformity. Ape thumb deformity. So for every nerve, you should always learn the characteristic presenting feature of that one, guys. For example, ulnar nerve, the patient is always going to come to me with a partial claw hand. Okay. For example, the radial nerve, in the radial nerve, we have to actually check for the wrist drop or the finger drop. Okay. So similarly, in the median nerve injury, okay, whenever there is a median nerve injury, one thing that you have to keep in your mind, the patient is going to come to you with the ape thumb deformity. There will be ape thumb deformity. Is it okay? Fine, very clear. I hope this concept is like crystal clear. So when median nerve is gone, all these muscles are gone except the adductor pollicis. The thumb will be in adducted position, and that is actually the feature of apes. So that is why it is nothing but ape thumb deformity. Next, number 2, second thing. And again the same thing, guys, don't worry about the writing part. I'll make you write down everything in detail. First, understanding is important here in a flow. So let us understand in a flow continuously in one go, then afterwards we'll write down. Now second thing to understand here is, for example, if the median nerve is gone, then what about the flexors here in the forearm? Flexor muscles in the forearm. It will be supplying to like all the flexors in the anterior compartment except the medial one and a half. Well and good, fine. Now, when median nerve is injured, then what you do is you ask that patient to actually make a fist. For example, median nerve is injured here, higher lesion near the elbow. It can be anything like pronator teres syndrome or a fracture, something. So if the median nerve is injured here, what you do is you just ask the patient to make a fist. Now in the normal people like you and me, we can make a complete fist here. But when median nerve is injured here, then what is going to happen? All the flexors are gone. Okay, all the flexors are gone. And important in that one is actually your FDP, flexor digitorum profundus. Only the lateral half is gone, but the medial half is still working. Why? Because it is supplied by ulnar nerve. Understanding? So the medial half of that FDP is working, but the lateral half is gone. Okay, so therefore ask that patient to make a fist. What is going to happen? Because the medial half is working, when he's trying to make a fist, yes, this will be flexing weakly. Okay, in a weak manner it will be flexing, but the index finger and all this will not be flexed. Why? Because FDP on the lateral side is gone. And we have learned in the muscle swallow section that FDP, the tendon of that will be going deep inside up to the distal phalange. So that is not able to flex. So therefore, this represents like a pointing index, guys. Pointing index. So there is another sign involved in the median nerve injury. And the third thing where you have to focus, the third and the last thing where you have to focus is about the palmar cutaneous branch and the digital branch, guys. Palmar cutaneous branch and the digital branch. Is it okay? So if the injury is occurring like proximally or distal to that one, I hope you'll be able to manage with this one. Is it okay? So now, final conclusion here is that in the median nerve injury, you have to have like your eye on 3 positions or 3 locations. Number 1, you have to look for the ape thumb deformity. Number 2, you have to look for the pointing index. And number 3, you have to look for the sensory loss, guys. So let us just make a note of all these things. Median nerve injury. And again the same thing, the median nerve injuries we can divide into 2 categories, the high lesion and the low lesion. So first let's see the high lesion. And then what are the examples of this high lesion, guys? How the median nerve can be injured like in a high lesion near the elbow? Yes, it can be the pronator teres syndrome, number 1. And number 2, it can be a fracture, supracondylar fracture. Supracondylar fracture of humerus, the median nerve will be involved. And number 3 that we have discussed in detail, that is Struther syndrome. So pronator teres syndrome, or it can be due to the supracondylar fracture or Struther syndrome. All this will be involving the median nerve, high lesion of the median nerve. Now, what is the sign? What is going to happen here? In high lesion, what is the sign, sir? How the patient is going to come to you? Number 1, ape thumb deformity. Yes, it will be present there, guys. And you know already the reason, guys. If the median nerve is injured here only, yes, why will the ape thumb deformity occur? Why? Because all the muscles of the forearm is also gone, as well as the muscles in the hand supplied by median nerve are also gone. So there will be ape thumb deformity will be present. Number 2, what about the pointing index? Yes, the pointing index will also be there because this FDP muscle on the lateral half has been paralyzed. That is why, yes, even pointing index will be there. But you have to be like really careful here. Most of the students during the live classes, they question a lot. So the pointing index is also looking like almost like, ulnar claw hand, the partial claw hand. Then how to differentiate? Remember, pointing index is formed only when you ask the patient to make a fist, not always. The patient is not going to come to you with a pointing index. No, not at all. So we can say the pointing index is present only in an active thing. That means while making the fist. But whereas when it is ulnar nerve injury, in the ulnar nerve injury, the partial claw hand, that is ulnar claw hand, will be always present passively. Understanding? So that is the clarity. In pointing index will be formed only during the formation of the fist, when you're asking the patient to make the fist. And number 3 now, guys. What about the sensory loss? See, if there is a higher lesion of median nerve, you don't even have to think about that. Both the palmar cutaneous as well as digital branch, both of them are gone. So there is a complete loss of sensation on the lateral 3.5 hand. Okay. So therefore, sensory loss of lateral 3.5 hands. When I'm writing hand there, it includes both the palm as well as the digits also, guys. So the lateral 3.5 palm as well as the digits also. That is with the higher lesion. Now, once you are done with the higher lesion, let us just finish off this one by writing about the lower lesion, guys. Low lesion of the median nerve. Now, what are the reason for the lower lesion? Yes, the very famous one, carpal tunnel syndrome. The median nerve can be involved in the carpal tunnel syndrome here, guys. Low lesion. Now, what is the sign of this one? Number 1, will there be ape thumb deformity? Of course. Ape thumb deformity will be present. Number 2, guys, will there be pointing index? No, the pointing index will not be there here, guys. I'm just writing here as minus. No pointing index. Why? Why? Because the injury to the median nerve is actually at the level of, near the carpal tunnel, guys, here, near the wrist. So if it is near the wrist, proximal to that, whatever muscles that you have here, they're not involved, they're not paralyzed, they're still working, they're spared there. So because they're still working, yes, you can make a complete fist there. So there'll be no pointing index. Number 3, and very important thing, that is sensory loss. Let us again just go back to this image here. Now look at this diagram here. If the median nerve is injured in the carpal tunnel, injury is here in the carpal tunnel, then only which branch is involved there, guys? Only the digital branch will be involved. Whereas palmar cutaneous branch is actually originating proximally only, proximal to that one. So therefore it's still working. That means if only digital branch is involved, sensory loss will be there only in the lateral 3.5 digits, not the palmar aspect. Not the palmar aspect. Why? Because palmar cutaneous branch is still working. Okay. So that is the reason why I told you that very clearly there. So let us just mention here the sensory loss of only lateral 3.5 digits. Why? Because only the digital branch is involved, and better you write down there no palm. Okay, not the palm, sir. So sensory loss of only the lateral 3.5 digits only, guys, not the palm there. That is the condition in the carpal tunnel syndrome. So by this, I hope you'll be easily able to differentiate between the higher lesion of the median nerve and the lower lesion of the median nerve, guys. And by this, we complete the entire median nerve, the entire normal median nerve about the motor supply and sensory supply, as well as the median nerve injuries also, guys. And this diagram, as usual, practice twice or thrice. And during the exam, if the clinical questions comes, this picture should come in your mind, guys, definitely. Okay, that's all. Thank you.